All right. I am with Jonathan Shedler. Everybody, welcome to Walk-ins. Welcome. Thank you for taking the time to talk to me about all things therapy. A very hot topic these days.
Evidently so.
Yeah, just give us a little bit of an idea of your background before we really get into a lot of the stuff that I want to talk to you about today.
I'm a clinical psychologist. I'm a professor of psychiatry, clinical professor of psychiatry at UCSF, University of California, San Francisco. I'm one of a pretty small handful of people who's lived in the research world, the academic world, and the research world, and also the clinical practice world. So I have a bit of a different perspective on things, perhaps.
How come that would give you a different perspective?
Because in the psychology and psychiatry professions, it's a very bifurcated world. You have clinical practitioners who treat patients and they live in one silo, and you have academic researchers who, conduct research and publish studies, and they live in another silo. They don't have the same training. They don't have the same background. They don't talk to each other. They know very little about one another's worlds. And, often what they're doing is at cross purposes.
Mm-hmm. It seems interesting too, not only is therapy bifurcating, but also even within therapy, there are so many different licenses you can get. It used to seem like you would treat more holistically, or as a therapist, you should be able to treat trauma and OCD or whatever. And now it seems like you have to get a license or specialize in each one of those things.
You don't have to get a license in each one of those things, but I honestly don't know how, the average person possibly finds their way to a, qualified, competent therapist. I was, I got curious about something going on Twitter, and I started looking. People would show up with different letters after their name, and I started looking at what are the different kinds of designations for kinds of licenses in different states. And I think I found something like 60 different kinds of like licensure credentials.
Mm-hmm.
And then just like to take it even further, a lot of therapists or people, I'm going to say therapists with quotations because it's not clear what therapist even means anymore. But a lot of therapists have listings on Psychology Today, and they have drop-down menus, and you get to indicate in the drop-down menu what's your profession. And there were, I think, 70, 75 or more different choices.
Right.
And it just drove home to me so clearly. First of all, there's no such thing as a therapist. The word has no legal meaning. It's not a profession. It's an activity. It's not a profession. It's not a credential. So when somebody goes to a therapist, and that's all, like, like that's their understanding of who they're going to, you have no idea who you're going to, what their training is, what you're getting. And by the same token, when somebody introduces themselves as a therapist, or that's how they list themselves in some directory, they're hiding something because somebody with legitimate credentials tells you the credential. So,
Right.
we've got what I call, kind of psychological illiteracy in this culture about what psychotherapy is and what it should be, and what you reasonably have a right to expect.
Right. What can you answer those questions that you just presented? What is psychotherapy supposed to be?
Well, there's a lot of different kinds of psychotherapy, and that's one of the problems, that just like you said, things are fragmented into a lot of different camps. There are a lot of people in the field who have very minimal and often very questionable training. you just have no idea what you're getting.
Mhm.
Now, I would distinguish between I would distinguish between psychotherapy on the one hand and oh, well, and two things. Crisis management. Oh, you're here not to. Let me start the other way. To me, real psychotherapy is fundamentally about changing something about ourselves. It's
Mhm.
about coming to know ourselves more fully and more deeply, right? So that we can create the freedom to not have to keep doing things the same old way. When people come to therapy because the way that they are operating, who they are, how they function in the world is causing difficulties for them. Right. So what we're trying to do through deeper understanding and self-knowledge and self-awareness is create the option to be able to do things differently, right? In a way that allows life to be easier or, more satisfying, more rewarding.
Mhm.
But then there's an awful lot of other things that people call therapy that really, have relatively little to do with that.
For instance.
Well, um, there's been a trend in the therapy professions, plural, in recent years, uh, that people think of therapy as going in and getting some good feels. They'll get
The vibes.
comforted, they'll get caretaking, they'll get comforted, they'll get soothed, they'll get validation and empathy, and but it's completely divorced from the understanding that the purpose of the work is psychological change. It's to change something about ourselves, right? It's not empathy, understanding, support, validation for its own sake. It's with the idea that when the person comes out of therapy, you know, something about them has changed for the better, right? They're a
Mm.
different and better version of themselves. So one version of what happens in therapy is a sort of endless affirmation and validation without without the idea of change being front and center.
Mhm.
Another version is, well, you go in for a very specific problem, right? These are the sort of, they're often promoted as evidence-based therapies is the term, and we can talk about that. But the idea is you're there to manage, or alleviate certain very, specific symptoms, and that's divorced from, changing something more fundamental about who we are and how we function in the world. And it's divorced from deeper self-understanding or self-awareness. So it's a much more sort of medical approach, right? You have this symptom, you're going to come, we're going to do these procedures, these kind of standardized procedures, and make the symptom go away. The truth of the matter is these kinds of therapies in the long run actually fail most people most of the time. They call them evidence-based as if they're scientifically demonstrated, to work for most people. And that's not true either. Anyway,
What's an
so
ex what's an example of an evidence-based therapeutic
well,
technique or
so yeah, so there's kind of there's the PR of it and the reality of it. I mean, evidence-based sounds like, I think if the average if the average, educated person hears the term evidence-based, I think what they think it means is, you know, there's scientific evidence that this is the most effective way of approaching my problem, and that there's evidence that I'll actually get well.
Mhm.
And right, that's the PR, right? That's the
Right.
narrative, but the PR isn't the reality. And so, really, the therapies there's a group of therapies that are actively marketed and promoted, under the banner evidence based. And what it almost always really means is that these are very, very brief therapies, you know like typically 8 to 12 sessions. They're not about getting to know you or understand yourself more deeply. They're literally conducted according to instruction manuals, right? So the evidence-based really means uniform, standardized, procedures that are decided on before you even walk in the door, right? And it's very brief. And actually, one of the things we know from research is we have some, you know, everybody's different, everyone's an individual, but we can say some time parameters about how long it really takes for meaningful psychological change to start to happen. And it doesn't happen in 8 weeks. Right?
Yeah.
So the therapies that are promoted as evidence-based therapies actually are over before, meaningful, lasting psychological change even starts.
Now, is this like cognitive behavioral therapy
Yeah,
or?
almost all of the therapies that are promoted. Well, no one even knows what cognitive behavior therapy is anymore. It's a very, very big umbrella. But yeah, pretty much all of the therapies that are most often promoted as quote unquote evidence based are variants of CBT.
I wonder how much this has to do with insurance only covering 8 to 12 sessions.
It has a lot to do with that, but it's actually more complicated than that, right? So there's a kind of an unholy alliance. It's not a conspiracy. They're not in cahoots with each other. It's I mean, it's more of an accident. But right, health insurers are in the business, of course, of not paying for anything more than they absolutely have to. So
Mhm.
they have a powerful financial incentive to steer people to the most minimal kind of treatment, right?
Mhm.
I mean, if they have a choice between, we can make an analogy to other areas of medicine. There's treatment and there's immediate first aid, right? They're not
Mhm.
the same thing. You might need to start with first aid. If they can steer people toward first aid, a quick band-aid, rather than dealing with the real psychological issues, they have a powerful financial incentive to do that.
Mhm.
That's only part of the equation, right? So, but they have a lot of clout to get to to steer their members in one direction or another, to get out a certain PR message, a certain narrative about what therapy should be. The other half of this goes back to the very first thing we said about the bifurcation in the field between academic researchers and clinical practitioners. Most of the research that drives this whole narrative about that there's such a thing as evidence-based therapy is done by people who don't know very much about psychotherapy. They're not in the business of doing therapy. They're not treating patients day in, day out. If they're an academic psychologist, it's literally true that they may never have treated a patient in their lives,
Wow.
or they may never have treated a patient, beyond very brief treatments as a graduate student. They are not experts in therapy.
Mhm.
But journalists and public policymakers always go to the researchers. You
Mhm.
published an article, you're the expert. And they're making recommendations about what therapy should be like that are just bizarrely divorced from reality. I mean, it's really going on in a parallel universe.
Mhm.
Um, and when we say 8 to 12 sessions, we know that meaningful change doesn't happen in 8 to 12 sessions. We have a lot of research that tells us this. So why are researchers studying therapies of 8 to 12 sessions? Well, because they have issues regarding their own career and professional advancement that actually have nothing to do with answering meaningful questions for therapists or patients, right? So there's publication cycle. You live and die in the academic world based on publications and research grants, funding, right? And it would be professionally suicidal for a non-tenured faculty member to study therapies of realistic duration, 6 months, 12 months, 18 months, when their colleagues are racking up publications based on 8 or 12 session therapies and getting grants on that basis, right? So we have an incentive system within the academic world to study things that really have very little to do with the clinical reality on the ground.
Mm-hmm. I'm a huge proponent of therapy, and it's helped me change my life. And I don't, it
I love to
definitely
hear
didn't
things like
happen in
that.
8 to 12 weeks.
I mean, to 12 weeks is barely enough time to say hello.
Yes. It never seems like the thing either. The thing you go in for is never the thing. It
Well,
was
no, it never is. And the person, see, I mean, this is kind of the fallacy of this, diagnose and then follow an instruction manual approach. It takes a while for someone who comes to therapy to begin to reveal themselves to us. It
mhm,
takes it takes trust. It takes trust in the therapy relationship. That trust doesn't happen on somebody's timetable, right? It doesn't. There's no single event that creates it. Trust develops out of hundreds or thousands of little micro interactions over time. And it's not just that it takes trust for someone to increasingly reveal themselves to us, the therapist. It takes some doing, some work for them to be able to begin to reveal themselves to themselves. Right?
mhm.
I mean, people come in, we go to therapy because things are causing difficulties that we don't fully understand. We can't come in day one and say, yeah, well, this is what's wrong and this is the problem. I mean, all we know is kind of the surface level of what we experience as cause. We know the effect, not the cause.
Right.
And if it's meaningful therapy, what I call meaningful therapy, we're not we're not providing first aid for the effect. We're in the business of trying to understand causes and address causes, and that's what we're trying to help the person change.
How does one go about finding a therapist?
I have it's the Wild West out there. I wish I had a good, clear, simple answer. It even even I don't. I mean, unless it's somebody I personally know, I know their work. I mean, even I don't know how to go about finding someone that I really trust that they're going to do right. I did. A friend of mine, friend and colleague of mine, did a kind of an informal survey a while ago. We were we were thinking about writing a book about what does really good therapy look like, and we had the idea of surveying our colleagues who are PhD level psychologists and professors of psychology and psychiatrists, MDs and professors of psychiatry, right? So these are people at the, where we were asking people at the highest level of qualification. And the question was, what percentage of your professional colleagues would you really want to treat a loved one or a family member, someone you care about? And the answers ranged from a low of 1%, to a high of about 10%. They seemed to converge around 5%. So we came up with the title of a book that we never ended up writing, but the book was going to be called 5% Therapy. So how
Mm.
to be that therapist, how to get that therapy. Um,
So how would you get that there? What does that 5% look like for somebody like you?
so for one thing, there's an understanding that we don't fully know ourselves. There's layers of experience. And, the problem that you see on the surface isn't necessarily the problem, right?
Mhm.
It's a symptom of a problem, or it's the effect of something, not necessarily the cause. And that really good therapy is a process of working to understand what's going on psychologically, beneath the surface of things, right? How can we understand what's giving rise to the difficulties? So, I mean, in just a very pragmatic way, suppose you have like a pretty common symptom like depression, or anxiety or an eating disorder. Think about the things that are the we call the presenting problem that bring people in.
Addiction.
Addiction, that would be another. A good therapist doesn't say, okay, well, we're going to treat your depression. Here's what we're going to do to treat your depression. Here's what we're going to do to treat your anxiety. Here's what we're going to do to treat your addiction. That's really, that's not how it works when it's good therapy. What a good therapist says in one way or another is, let me say it a little differently. If we're going to use a medical analogy at all, depression, anxiety, addiction, eating disorders, I think it's a lot less helpful to think about these things as disorders or diseases in their own right, but as what we call nonspecific symptoms, like fever. So, for example, fever is a nonspecific symptom of an enormous range of underlying disorders, right? From the common cold to, to Ebola to Ewing's tumor,
Right.
right? That it's
Infection.
non-specific. It's right. It's the most readily observable manifestation of a huge number of possible difficulties. And when you go to a good doctor, they don't, it's not like they say, well, here's some aspirin and, here's some aspirin, call me in the morning, that'll bring down your fever. That's not the job. The job is to figure out what's the cause of the fever. Maybe it's something that's not serious. Maybe it's passing. Maybe it's a common cold. Maybe the answer is, well, go home and take 2 aspirins. You'll be all right. Maybe you have a bacterial infection and you need an antibiotic. Maybe you have some kind of serious systemic, condition. The job is not treating the fever, but understanding what's causing the fever and treating that. And when a patient or a client first goes into therapy, the truth is neither they nor the therapist knows yet about what's going on under the surface of things that's giving rise to the difficulty. So really good therapy begins with some version of, talk to me. Let me learn about you. Let's see if we can arrive at some understanding. Right? That makes sense to both of us. And right, so you have to articulate or define what is the purpose of the work of therapy? What are we trying to accomplish here? And, sorry if I'm being a little redundant, but that's not immediately obvious at the start to either person, and neither one of them can figure it out by themselves. If the patient could come in and say, this is the problem, this is what's wrong, this is the underlying cause, if they could do that, they wouldn't need us.
Right.
And we're not mind readers, therapists, right? We can't just look at someone or, give them a questionnaire or talk to them for 20 minutes and say, oh, well, this is the problem. This is the cause. It's a job for 2 minds together. Right? We have to collaborate together, mutually around a shared task. And the shared task is to understand one of the people, the patient, more deeply, in the service of figuring out what's going on that's giving rise to their difficulties. What would need to change to make a real difference? Is it something the person desires to change about themselves? And is it something that's, realistically possible or likely to change in psychotherapy? And only when we, are able to articulate answers to those questions do we really have a foundation for proceeding. So I guess to bring it full circle, to answer your question, how do you find a good therapist? A good therapist is someone who works like that. They don't move from your presenting symptom or your diagnosis to a treatment. They don't say, oh, well, this is your symptom, therefore we do this, or this is your diagnosis, therefore we're going to do that. Right? It's someone who's willing to engage in this process with you.
One of the questions I get all the time, just as someone who's not even a professional, just from many people in my audience, because I'm always talking about therapy and how much I like it. What questions should people be asking when they're, interviewing a therapist or looking for a therapist?
What's your understanding? This isn't a question from the get-go. This isn't a question that emerges after you've spent some time, but what's your understanding of what's causing difficulties for me?
Mm-hmm.
And the answer should not be in theoretical words. The answer should be in very, immediate experience, near relatable words that speak to you and your experience. And how would therapy work? What would we do here
Mm-hmm.
that would help me to change those things? And if the therapist is worth their salt, they damn well better have an answer. And it's not the same. It's not some prescripted answer that comes from their school of therapy. Here's how therapy works. It's the same answer for everyone. It's an answer for you specifically based on not their understanding, based on the shared understanding that the two of you have arrived at, and so agree. Oh yeah, this is going on. This is causing difficulties. The patient should be able to say, I see that. And I get into the therapy world is so fragmented and so divisive. I'm going to get into trouble for saying this, but I would want to know. Right? There's three kind of central pillars of what goes into the training of a therapist, and I think the most important of the three pillars is personal therapy for the therapist. I would want to know, how much personal therapy have you had?
Mm-hmm.
And the answer, and the answer can't be, I've been in therapy for 2 years. No, like in hours. How many sessions? And the answer should be in the hundreds, at
Mm-hmm.
least. And there's a reason for that. That we can learn whatever we learn in our books and courses, academic study. If we don't see it, if we don't experience it in ourselves, it's just theory. It's just
Mm-hmm.
academic,
Mm-hmm.
right? We as therapists have to change first. We have to develop ourselves. Because what we're really saying to the person is there's an awful lot that you've never really talked to anybody about. There's an awful lot that you don't even talk to yourself about.
Mm-hmm.
And what we want to do here is create a relationship where it becomes increasingly possible to talk about all of these things. And these things are things that are unpleasant, uncomfortable, painful, sometimes flat out terrifying. Uh, uh, we have to be able to go there with them.
Mm-hmm.
We have to be able to go into the darkest recesses of somebody else's mind. Well, that requires that we have to be pretty damn comfortable, right, in those dark recesses. It means we have to have gone there ourselves.
Yeah, it's interesting times we live in because on the one hand, I talk about this all the time on the podcast, just how for all of the lip service mental health gets, everyone seems to be getting worse.
Well, it's true. And you said it exactly right. There's a lot of lip service, but not a lot of quality care. And
Mhm.
I think there's a lot of reasons for that, but one of them is there's just an unpleasant and hard truth at the center of this, that for meaningful psychotherapy to happen, first and foremost, that requires a meaningful relationship and time. And what people now call the therapy space. Everything has become a space for some reason
A
these
space
days.
or a journey?
The therapy space. Well, I'm talking about the industry.
No, I get it. No, I was joking the other day about like how everything's become a journey too, where it's like my sourdough journey, my weight loss journey, my.
That's a pet peeve of mine. Don't even get me started. Everybody's on their journeys. But look at all the players we've got here. We've got pharmaceutical companies, pharmaceutical industry. We've got the health insurance industry. By the way, those are the two biggest industries in terms of the money spent on paying for lobbyists and paying for political campaign donations. So those industries are shaping the landscape of mental health. Then we've got tech companies, right? Startup companies. We've got, right, matching you up with a therapist. We've got companies with, coming out with AI chatbots. We're already moving in the direction of, there's chatbot therapy, there's AI therapy, there's all kinds of industries that are springing up. There's going to be psychedelic therapy. Well, turns out, there's been ads that are going around on social media. It looks like it's a physician group. It's actually funded by a tech company, a big company, tech company, and they're just springing up like mushrooms. These clinics everywhere. Go in and psychedelic therapy.
No pun intended.
Yeah, the harsh truth at the center of this is real psychotherapy is a relationship. It takes time, and it doesn't scale. You can't scale a human relationship. All of these companies that are, in it and for the business of profit, all these startups and tech companies that are entering into the so-called therapy space, obviously they're in it for the profit, but the holy grail, how do you make something profitable? The holy grail is to do something that can scale, right? So if you can do it once, you can do it 1,000 times. If you can do it 1,000 times, you can do it 1,000,000 times or 10 million times. They want to scale, and a human relationship doesn't scale. So what is that? What happens? They don't say, "Oh, our bad. We misunderstood how therapy works. We're going home. We're gonna, we're gonna take our VC capital and invest it in something else." What? So because everyone's looking for something that scales, and a therapy relationship doesn't scale, what in fact is happening is everybody that's come into this sort of wild west of what the therapy landscape has turned into is selling something other than psychotherapy and calling it psychotherapy. And the harsh reality at the center of this, right, it's a relationship, and it's time, and time is money, right? And if people or society aren't willing to invest in that, but they're determined to get, therapy anyway, well, they're going to get something else that goes by the name of therapy, but is not psychotherapy.
Yes, there's definitely, and this is the other strange paradox. There doesn't seem to be meaningful therapy happening that's really, truly helpful. And yet the language of therapy is everywhere. Everything is trauma. Everything is, if you hear young kids talk now, they all speak in therapeutic language. And it has been, as Abigail Schreier says in her book about bad therapy, crop dusted throughout, guidance counselors and all of these.
Everywhere.
It's everywhere.
But the thing is, and people think this is about therapy. None of this is about therapy. Right? That this culture of therapy speak has nothing to do with actual psychotherapy. And we could talk about it if you want to. I would actually argue it's completely at cross purposes with what real psychotherapy is. Right?
Yeah.
It just, it's speaking in jargon and buzzwords that, sort of make the claim, that we're doing real psychological work. We're examining ourselves. We're looking at ourselves. We're growing. It's like the language makes the claim to self-examination and psychological work when in fact, more often than not, the language actually takes the place of the real psychological work.
It's
It's like we
very
it's
go
like we
on.
all want it's like we all want credit. You know, it's like we all want credit for doing this difficult work of examining ourselves and developing our character and growing as people. It's like we want credit for it without actually doing it.
Yes. That seems like so much of what I see, particularly in, for lack of a better term, the manosphere. There's a lot of this. You can go to a YouTube video and figure out how to like fix something about yourself, and I joke a lot about Instagram because I'll scroll on Instagram and there's a joke that I've been trying to work out. Like if I spent as much time on my nightly skin routine scrolling as I do on scrolling videos about nightly skin routines, my skin would be amazing. And I feel like this is kind of the crux of the same therapy problem. You can scroll endlessly and watch all these videos endlessly, convincing yourself that you're learning something about yourself or you're making a change, and you're really just scrolling, or it's like you're not actually taking action, but it feels like you're taking an
Even
action.
if you are taking action, there's something in it that misses the point, that misses something fundamental about the essence of psychotherapy. So, one thing that we have to understand, right, being humans, we have the longest period of helpless dependency of any species on the planet, right? A human infant is literally helpless,
Yes.
right? And for years. And we are very much who we are and who we become is shaped and forged in the context of our relationships, our attachments, our sense of how we see other people, how we see the world, how we see and experience ourselves is forged in the context of our relationships. And when people develop emotional problems, mental health problems that eventually, that may eventually lead to therapy, right, we have to understand not only are those problems forged in the context of relationships, they also play out in the context of relationships, right? We try to have relationships with people and things go wrong,
Mm-hmm.
right? Right. We find ourselves recreating certain kinds of, you know, painful or self-defeating patterns in our relationships, or we find ourselves, unable to create relationships to begin with. And, so we could say what gets broken in a relationship actually has to be repaired in a relationship. It
My
takes two.
therapist always says that to me.
Your therapist said that?
She says relationships heal. I never understood it because she laughs at me because and she was very patient with me because I was very much like, I'm single forever. I don't need a man. I'm fine with this. And she was like, okay. Because this is the other, there's so many terms too that are just the lingo in the culture that's really interesting to me. And something that I've been pondering a lot lately, this kind of idea of like it's a cope, the slang like, oh, this is just a cope. These people are just saying this because it's basically a defense mechanism, and they use it often in terms of like politics or something like that. But there's this idea. I was like, so much of getting older and my own process of getting to know myself is realizing that things that I was saying at a certain time in my life were a defense mechanism, but I could have never known that had I not changed.
Yeah, you can't, right? You don't know what you don't know. And, you can't really see where you are separated from the trajectory of, how you got there and where it's taking you.
Mm,
But I would say it, I agree. I would say it just a little bit differently, that none of us fully know our hearts and minds. Right? None of us fully know ourselves. It's not a disorder. It's not pathology. It's not a diagnosis. This is the human condition.
Mm-hmm.
And to bring it back to, because I think maybe I mean something a little different by relationships heal than what your therapist meant, maybe. The things that we don't know about ourselves become manifest in our relationships with other people, or
Mm-hmm.
our lack of relationships with other people, right? It's not, this isn't something we can do in isolation, in a
Mm-hmm.
vacuum, solipsistically. What do I not know about myself? I'm going to, figure it out. Here's this, course I can sign up for and to heal myself. The things that let's repeat this, the things that we don't know about ourselves show up and get played out in our relationships with other people. That's where they become, manifest. That's where they become visible. And we all, by virtue of being human, live out certain patterns, certain relationship patterns. We all do it all the time. It's just how we're built. And we're getting a better answer to your question, what's good therapy? This is how the therapy works, right? So we have these relationship patterns that we live out all of the time. Another way of saying it is, we look at the world through certain lenses, and these lenses are forged in the context of our earliest relationships. Psychotherapy is also a relationship. We go into psychotherapy and we bring those lenses, we bring those patterns with us into the psychotherapy relationship. And if the therapist is actually skilled, right, what the work is about is recognizing how these patterns play out, right, in our lives, in our relationships, but starting with how they're playing out right here, right now, in the room, right? Right. So, one way of saying it is, as a therapist, we count on the patient to fuck up the therapy relationship
Mm-hmm.
in the same kinds of ways that they fuck up their other relationships. And that's what makes it possible to recognize it, to see it, to understand it, to discuss it, and hopefully to rework it so that the person doesn't have to keep repeating the same painful and self-defeating patterns. So when we say the relationship heals, it doesn't mean the therapist is going to be nice to you. You have this warm connection. They're empathic. They're supportive. I mean, all of that is part of the therapy, but that in and of itself is usually not enough to bring about the kinds of changes we're really after. Right? It's not that. It's that we create the patterns that cause difficulties for us in the therapy relationship. And that's where it becomes possible to
Mm-hmm.
recognize and understand them. It's a very different meaning. When we say the relationship heals, it's much, much more specific.
Yes, I think she meant in terms of general, not just the therapeutic relationship, in terms of having a corrective experience, even in a loving relationship, having a corrective experience with family members, and yeah, I think about. It's funny. I don't know. It's weird to be in the space that I'm in because I often talk about how I don't envy it, but the people who seem to do the best in kind of the media landscape, for the most part, not everybody, have this sense of authority and certainty. And I feel like there's just always a fundamental, I don't know, I don't trust that. I think because I've been through so many transitions throughout my life of thinking I knew something and then later on realizing that I was full of shit. I'm never, I guess I'm never, there's some things I know that I know, but other things I'm like, am I just full of shit? I don't know. So that
But
doesn't,
it takes, but I mean, that, right, what you're describing, I mean, I know you're kind of laughing at yourself as you say it, but in fact, being able to understand things in that way really takes a lot of insight and emotional maturity, right? It's an understanding that the way we see or experience something just right now isn't necessarily the entire, the whole truth, that, we're more complex and nuanced and layered than that, that things are rarely, black or white, right? That, I mean, you're kind of backing into a fundamental understanding of psychoanalysis, which is, we're not a unitary. The mind isn't a unitary thing, and
mhm.
we people are not unitary. Right? We are not of one mind about things. We are of many minds about things, and not necessarily, immediately consciously accessible either. So it gives rise to a certain openness and a certain humility about our own thoughts and feelings.
It's interesting you said some of this is just basic human condition earlier, to kind of circle back to that thought, because I know people like Matt Walsh, who's a pundit and a media guy, often who's very anti-therapy, which reminded me in some ways, it kind of reminds me of me when I was very anti like AA and I was at the bar. But he does make a point that some of this is just the human condition, a lot of the stuff that we've pathologized. And this is what I mean about the weird paradox we
Well,
live in.
yeah, I mean, he has a little piece of the truth there, but again, I mean, this is the kind of mental and emotional flexibility and sophistication that I'm talking about. It's recognizing, I mean, when it comes to matters of the heart, when it comes to things important in our lives, um, there's often not one truth. There are often many truths. And the problem with people like him who make these, declarative statements, this is the way it is. Sometimes what they say is true or partly true, but it's one truth among other truths. And just your instincts are right, or the instincts that you've developed over time, right? I mean, you earned them, are spot on, that when somebody speaks with this sort of categorical certainty about, our inner experience, or about, how we live our lives, it's just automatically suspect, because it's sort of already denying, our sort of multifaceted nature and the complexity and, and nuances of experience, right?
Mhm.
So this happens in therapy all the time. Another way to think about defense, right? I don't tend to use the word defense mechanism, but let's use it for the moment. It's not that the patient comes in and they tell you something that's not true, right? So a common example is, somebody comes in and, you talk about their relationship with their parents in their childhood, and they paint a picture like, Disneyland. I had, I had a great childhood. I had a happy childhood. My mother, she was, wonderful. I love my mother. Eh, And, as you work over time, the person discovers, well, it's actually not that simple,
Right.
right? Maybe they're furious, with their mother, angry, spiteful, resentful, whatever. It's not as simple as saying, when they, say, I love my mother, I have these good feelings about my mother. Well, that's not true. That's a defense. What you really feel is furious at your mother, right? What is more often the case is they're both true. It is true
Mhm.
that the person loves, cares for their mother, has these positive feelings about them. And the issue where it starts to serve a defensive purpose is that they're using one truth to exclude or negate another truth, so that we end up, hopefully in the end, saying, it's not either or. It's not that you have either these feelings or those feelings about your mother or your father. You have these feelings and those feelings.
Mm-hmm. I always joke, embrace the healing power of and. I think that you recently had a thread that I loved because I cannot stand the my truth, and you're pointing to it right now. But that thread is brilliant, truly. I wish everybody who uses that phrase would read that, because it points to just such a clear. There's such a huge difference between my truth and my experience. The next level of questioning for me is why and how did we get to my truth? Because you make such a brilliant point that truth is something that you can't really change or negate. It is something that is true, and therefore you can't question it. It's not something.
That's the issue. I mean, it's not so much the word or the phrase, but that there's a kind of a subtext to it, and it's what you just said, that this is outside of this is beyond questioning. This is so. You can't question it. It's my experience. It's beyond question. And that's a psychological dead end. Because what we know through every single lens we look through, whether it's neuroscience, whether it's experimental psychology, whether it's psychoanalysis, I mean, right, the one thing we know is that our experience is multifaceted, complex, often contradictory. The hallmark of psychological maturity, right, is that we have the ability to call our experience into question, to reconsider it, to revise it, for our understanding to unfold, and for our understanding to evolve and unfold and perhaps change. And this continues for a lifetime. Right? That's what growth and development is, or at least it's a big part of what growth and development is. And the moment you take something and you set it apart from that, and in one way or another, the signal to the world, to other people, but also internally, what you're telling yourself is this, this is how it is. This is not open to question. Right? Then our experience becomes crystallized, and development stops. And there's theoretical concepts that we use in psychology and psychoanalysis. So one of the concepts is called mentalization, but it refers to the ability to shift perspective, to take perspective, right? To take the other person's perspective, to recognize that what we think, what we feel, what we do is, sort of motivated by internal experiences, right? Different states of mind. And those experiences are complex. And what other people do is motivated by internal experiences. And we can make some reasonable, often we can get a reasonable sense of what that experience is, but we don't have any direct privileged access to it. Right? So what we're trying to do in psychotherapy is expand mentalization, the space for mentalization, which is another way of saying expand the space to reflect, to reconsider, to question, to look from another perspective, to understand differently. We're trying to expand the space to think and feel and experience things beyond, where we start from. And when somebody says, often that phrase, my truth, this is no, we're not going to reconsider. We're not going to reflect on. we're not going to be open to the possibility that we might end up understanding things differently. This is fixed. This is so. Right? This is set aside outside of questioning. And then growth and development stops.
I'm very grateful to my sponsor when I was doing in 12-step program. I'm sure you're familiar with it just in general, but for people who are listening, there's a 4th step. And this is where you really the first step where you're supposed to kind of put pen to paper and do any quote unquote work at all. And it is where you write down all of your resentments, essentially, because in recovery and in AA, there's this whole idea that resentment will inevitably kind of drive you to drink if you let it fester long enough. It's one of the things that they consistently saw drive people out. And so you write down this list of people, places, things. It can be institutions. And my sponsor said, now this is where you write down they divide it up into columns, the person, the place, or the thing. And then she said, this is where you write down what they did to you or what you think they did to you.
Well, and that's an important distinction, really.
It was so, because for every incident, if 5 people witness it, there will be, even in a family, everybody has a different recollection of a similar incident.
Even the same person has a different recollection
Yeah.
on different occasions, depending on their state of mind and their mood. And this is actually an empirical fact. You think I did some research on this as a grad student, but I mean, there's voluminous research on this, that our subjective experiences, events happen and, we remember them, they're stored, kind of like a recording, you can access it. That's actually not how it works. That memories, what we experience in memories, are actually reconstructed. They're not stored there, right? They're reconstructed in the present and influenced by our present state of mind. And that, so for example, you can ask people about, say, their earliest childhood memories, and there's like certain core memories that, stand out as like, this means something. And you can do this with people who are suffering from depression and have them write down their memories of the event. And then they, either they work in therapy and they get better, or maybe just time passes and the depression runs its course. Anyway, they're now in a different frame of mind, functioning differently psychologically. And you ask them to write down the same memory, and it's changed.
Wow.
It's the same event. There's a, nucleus, the facts, this happened, but the memory changes. Right? People who study, eyewitness testimony in, courtroom settings understand this.
Right.
So, what your sponsor said, there's, what happened versus, how you experienced it happening. This is directly relevant to that concept I just used, mentalization, right? Mentalization is the ability to consider, reflect, recognize so when mentalization collapses and we can't think freely, fluidly, allow our understanding to develop and evolve, it collapses in different ways. One way it collapses is something called psychic equivalence. And it's a fancy word for what it means is the person acts as if what they think or feel, right, in their mind is synonymous with external reality, right? They don't draw a distinction between their perceptions and, what may be happening in the external world. So a really, common and straightforward example of that is, somebody said or did something, whatever, and it hurt you, right? Mentalization is, what was going on with that person? Why might they have said that? What's the range of reasons about why they said it, what they might have meant, what they intended, where they were coming from? That's mentalization. The opposite of mentalization, psychic equivalence, they hurt me. They meant to hurt me.
Mm.
They're out to hurt me. They want me to suffer. Their goal was cruelty. And we don't make a distinction between our perception versus, the much wider range of possibilities of what might be going on. Maybe the person didn't even know how what they did affected you. Maybe. There's, there's infinite maybes.
It makes me realize why I love I have this little plaque right here that says it's not about you, because it's a good reminder that a lot of the time when I'm doing work, it's not, I'm always reminded when I'm like, I don't want to do this anymore by an email or something, that it's not just about me, but it's a bigger, I see too, that it's a reminder that it's often like they're not calling you back because they're busy. They're not even,
for example,
they're not getting back to you.
They're not calling me back because you feel dismissed or erased or hated or
rejected,
disregarded. They didn't call me back because they hate me. They didn't call me back because they don't care about me.
Did you see this meme? I don't know if you're on Instagram at all, and if you, I'll send it to you on Twitter or something. But it is hilarious. It's all about interpreting texts, and it's like how an anxious person interprets text messages. And the guy is like, "You hate me." It's like, LOL, you hate me, LOL. And he's like, see, you might think that oh no, you're mad at me. That's what he kept saying. You're mad, LOL, you're mad at me. And he keeps all these examples. He's like, by that period, by this statement, I'm not mad at you. You might not think that I might not think that you're mad at me, but that period lets me know that you're mad at me. And it's like,
I'd love to see that.
The last one he ends with is call me. And it's like, everyone is dead and you're also mad at me. And I was like, this is the perfect example. It is funny too, because when you talk about the psychic equivalence, when you describe it, it sounds like everyone in the culture right now. I mean, perhaps I'm too online, so there's that.
There really is something going on in the culture that seems different. In recent years, there's something going on in the culture that, almost seems to invite and encourage this way of thinking, a certain, kind of black and white thinking, rather than holding complexity and nuance and ambiguity. Like, if we're talking about human beings don't come in, categories of, black and white. Human beings come in, complex, nuanced shades of gray. I mean, with, I think, some pretty rare exceptions, people are good and bad. The world doesn't divide into, heroes and villains.
Yeah.
And like in the past, I think, people who thought that way, who thought in this very sort of categorical black and white way, I think the world would sort of nudge them in the direction of, it's not so simple. There's more to, there's more to understand here. And I feel like, now often the world nudges them in the direction of, yes, you're right. There is good and evil, and you're on the side of good. The people who think like you are on the side of good, and the people who think differently, well, they are evil and they're on the side of bad. And, we must, the good must defeat the bad. And it's like, this is like the script of a B movie. This isn't how, this doesn't reflect the complexity of the world.
It's weird being in this politically homeless place that I've been in for now a while. It's strange. Sometimes people will be like, this is for the soul of America, or like, this is the battle of good and evil. And I have to go to their page to try and figure out like which side they're on.
Really?
And I've asked this question, if everyone on both sides thinks that the other side is evil, that seems like not a great place to be in culturally. Yeah, there's something else that you were talking about that I loved. you have, if people are listening, they should definitely go follow, and they're on Twitter, which I don't recommend. But they should go follow.
Yeah, you shouldn't be on Twitter in the first place. It's like
or
a waste
X
of your
or
life.
whatever.
But if you are on Twitter, go visit
you
me
should
at
follow
Jonathan
Jonathan.
Shedler.
Are you kind of, how do you feel? Have you seen Jonathan Haidt's new book about the anxious generation or whatever? Are you on board with this idea?
I read reviews of it. I didn't actually read the book, so I mean, I can't, I can't
speak to it.
I can't say I have strong feelings about what he wrote because I didn't read what he wrote. But I mean, based on what I'm gathering from what other people have said about it, I mean, it seems like he's onto something.
Mm-hmm. Like the premise that the internet is bad for us and that it's making everyone anxious and crazy. It's funny because I've had so much good come from the internet too, and even if it's definitely a double edged.
It's not good or bad; it's good and bad.
Yeah, like humans, because it's just really a reflection of us, plus a bunch of tech companies and algorithms manipulating all of the most basic things in our brain. But aside from that, it's just humans.
Well, there's an interesting question. I've been debating it with an online friend on and off, but and of course when we debate it, it's like, I'm right and you're wrong. But I think maybe we're both we've both got different pieces of something that's right. Is there something about the anonymity? The distance, because I mean, a certain number of people in the world are, really have some pretty significant, personality problems.
Mm-hmm.
And there's something about the pace and the anonymity of online exchanges that it just, if those problems, personality problems are there's something about it that's likely to really, bring them to the forefront, amplify them. It's like, it's like you get this forum where, you just, express the worst parts of yourself in this unrestrained, unbridled form. And that was my side of the argument, and I still think it's true. But my colleague brought up something else, which is, this is a gigantic experiment in behavioral reinforcement. You say things, you put things out there, and they get reinforced or they don't get reinforced, and reinforced in reinforcement in the form of clicks and engagements, and so we're bringing our personalities into it, but we're also coming into an environment where where certain things are reinforced and certain things are not reinforced, and that the algorithms, the other people and the algorithms are shaping us towards certain behaviors, and I would say and often more and more extreme behaviors.
Mm-hmm. Yep. And then you have, foreign influence bot farms and all kinds of things that they are finding are radicalizing people. Are you familiar with, I believe his name is John Suhler's work? He wrote a book. I might have it here. But he talks about this. He was one of the very early people talking about the kind of psychology of the online behavior. And he calls it this online disambiguation, where people become a different version of themselves, essentially, or some version of themselves that they don't get to be in real life, because of socialization and manners and social
and
consequences. And I wonder too, after the pandemic, it was like everyone forgot their manners and nobody knew how to behave when we came back into real life. I wonder, it seemed like it worked one way. And one of the questions I had for him when I interviewed him, not for the podcast, for a piece I was writing, was how long before that works the other way, where the person that we are online and it starts to bleed into real life. And I guess it turns out it's not that long.
Yeah, exactly.
That was like 5 years ago. So
and it's also, arguably the world's largest uncontrolled experiment in projection.
Yeah.
Because other people online are like Rorschach ink blots. You don't really experience them in this three-dimensional way as whole human beings, right? Other people become projection screens. And there's this old quotation that's been attributed to lots of different people and places at different times, but the quotation is, we don't see the world so much as it is, we see the world as we are.
Mm-hmm.
And it's about projection. You interact with these people and you see them, you see in them, something perhaps that you prefer not to see in yourself. And then you can hate them for it.
Yep. And I don't have to hate myself. I wrote down all of these questions, and where I could talk to you for hours. Clearly, I'm just gonna ask you some of them. What did Freud get right?
Oh my God!
They're like, do you have another hour? Or maybe it's 2 minutes.
Freud wrote 24 volumes and thousands of pages and constantly changed his own views over the course of his lifetime, again and again and again. And then more than a century since Freud has written, other psychoanalytic thinkers, and therapists following in his footsteps have revised things over and over and over again. I mean,
he killed himself, right?
No.
Did Freud? No. Who am I thinking of who killed himself? I thought it was Freud who killed himself, but maybe not.
But the point is, there's the complexity of what Freud, the person, said. Then there's the fact that psychoanalysis today, right, the branch of the approach to thinking about mind and behavior and therapy that originated with Freud, and it's been evolving for more than a century. It's not your great grandfather's psychoanalysis. So
right.
What Freud said is often neither here nor there to what contemporary practice of psychoanalysis is. Anyway, but to answer your question, what he got right is we don't know ourselves fully.
Mm-hmm.
We don't know our own hearts and minds. That's the human condition. There are things that we can do. And, he laid the foundation for a method of therapy to help us come to know ourselves more fully and deeply. And there's great benefit in that. And I think that is really the essence, the heart of psychoanalytic thinking, psychoanalytic being an approach to psychology and an approach to psychotherapy, that originated with Freud. But it didn't end with Freud. It didn't end with Freud any more than, our understanding of astronomy and astrophysics ended with Copernicus, or the study of evolutionary biology ended with Darwin. Mm-hmm. So it rankles me a little bit when people think, it's like Freud. It's like, well, let's talk about the present.
I only bring him up because he's been so dismissed now. I think there's been a big pushback to him as a figure. He's been a bit maligned over the years, and I don't know if his reputation is. I feel like there's just an overall.
How do you feel? If you, if you get on airplanes and and if you're involved in air travel, aviation, how
do I feel?
How much time do you spend thinking about what you think about the Wright brothers?
Yeah. It's interesting. It's funny too, because I don't know that my grandfather even thought, and I interview somebody on this podcast regularly about his book that he wrote, Mediated, and he talks a lot about how therapy and mediation kind of came to be around the same time, because my grandfather, in his case, his grandfather, who would be my great grandfather's age, they weren't even thinking in these terms of like, how do I feel? These ideas weren't even something that I kind of always joke, like, bury that shit deep, like the Greatest Generation.
Yeah, well, also, a turning point with Freud, and it's like people grab onto really pretty, inaccessible and peripheral ideas, and they miss all of the voluminous stuff that is simply just part of the culture and part of the culture of psychotherapy that everybody takes for granted. And it's like, well, you know what? It was like actually radical when
Yeah.
Freud came up with it. And one of them is, most of what we now think about as mental health problems or mental health symptoms before Freud were misunderstood as medical neurological conditions, right, that needed to be treated biologically. And it was Freud that said, no, this isn't about your brain or your nervous system. This is about your mind. And right, we can help just by talking and listening and understanding. Right? So, he took an awful lot of things that we now take for granted as, this is about mental health. And he's the one who brought them into the realm of mental, whereas before they were considered nervous diseases.
Right. Wow. It is amazing. Now it's just everywhere. It's hard being a new mother in this culture, though, I will say, even with like the trauma stuff being everywhere, because on the one hand, I look at something like AA, which is not trauma informed at all. And so I was grateful to have had a sponsor who, when I went through my fourth step, and it's like somebody who abused me or whatever, she was like, above my pay grade, take that to a therapist. She wasn't trying to work above anything that was out of the scope of being able to just help me with work a step.
Well, that takes a certain wisdom too.
Yeah. And so we could go through, and it's like, oh, here's this resentment from this person. And it's like, oh, that's capital T trauma. Take that to a therapist, because I'm not that person. So there's that, and now everything is trauma. And even when I was debating, sleep training is always when you first have a baby, everyone's like, how are they sleeping? And I read something by Gabor Mate, and he was like, if you let your child cry, they will feel like the universe doesn't care about them and have a psychological scar for the rest of their life. And I was like, well, the universe doesn't care about me. Shouldn't she know on some fundamental level no one's coming?
We're just specks of dust in an infinite universe. But he's also, I'm just going to acknowledge, I have not read his work, but it's comments like that I find off-putting and misleading. That there's a very old concept in psychoanalysis. So after Freud was like, oh my God, everything that we do is going to affect our child, or my baby for life. And right, I mean, it's the sort of thing that could make mothers especially very paranoid. Like, I have to be a perfect mother
or neurotic.
There's a concept called a good enough mother, right? I mean, we were the product of eons of evolution. I mean, first of all, perfection is impossible. And secondly, what a child needs is not a perfect mother, but a good enough mother. And that's to say, you're somehow damaging them for life, because, you got there, a moment later than you would have liked to, and they were crying. I think I don't think that's a realistic view of things. I mean, and it looks like he says some things that are like very important that are important for people to understand and think about. When you take it to such an extreme, then I think it causes its own problems.
Well, and this is how you end up in, like, now it's the consent childhood where parents, have you heard this, where parents are asking their babies consent to change their diaper before they change their diaper, and they're having these very long conversations with them before they do, give them a bath or anything like that. It's like,
Yeah,
or
but
before they hug them, they're like, do I have your permission to hug you? And
yes.
I mean, it's a thing that I've seen in the mommy world. It's crazy too, because it is all this stuff that you see on social media. And now I don't think it was I have a sibling who had kids very young, so even that, she's like, it wasn't this confusing. A lot of this is the internet. You know how to do this stuff. Just follow your intuition. There's so many options now for everything. It would make you insane
Yeah,
if you
but
really let it all in.
we are evolutionarily evolved. Children, babies, evolved to behave in ways that elicit certain responses from a good enough mother. And mothers, are evolutionarily evolved to be able to register those signals and respond in good enough ways. And it's not like we're not starting from scratch here.
Right.
We are part of the animal kingdom. We're mammals.
Yep. When you were talking about just how dependent the child is on, when I first had my daughter, I was like, how did we make it this far as
How
a
did
species?
the human race, how did the species ever survive?
How did we get this far? It does such a weird thing to your brain, that infant bubble. It's that was the big thing. You look around and are like, how did we make that? How did we make it this far with, a hundredth of the resources and medicine and care and war and famine and all kinds of things. And also it made me look at there was in the first month postpartum, everyone I saw was a baby. Even like the homeless guy sleeping on the street. I'm like, that was someone's baby. They had to care for this. They had to get them through a while before they could. It was like, it really did something messed up to my brain, or it put me in this state where everyone was a baby.
It did something understandable and predictable to your brain. We're wired a certain way. Hopefully, we're wired a certain way. I mean, there's reasons why you start thinking and feeling and seeing the world differently when you're a new mother.
Mm-hmm. That was a trip. It did. It's not like it wore off. I think the defense mechanisms come back up, because now you have to be mama bear. So I can't see the crazy person approaching me on the street as just a baby anymore. I have to be like, okay, this could be dangerous.
That's part of the wiring also.
It was very strange. It felt very like hallucinogenic or something. What is okay, I have to ask this question. If you could have one person from the past to work with,
oh my God,
who would it be? I know it's such a dumb but fun question. It should be fun. I should have started it with, other than Elon Musk, who would you work with?
I don't know.
Who was the first person that came to your mind?
Joni Mitchell.
Ooh, I love that.
She's not from the past. Last I heard, she's still very much alive.
She's still alive. That's okay, though. That's interesting. Just because you want to know how she came up with such cool songs?
Well, I mean, since you asked, like, honestly, uh, she really seemed to take a turn somewhere, to the dark side of things. And more specifically, I remember buying a CD. That's how long ago it was, right? You'd buy CDs. Remember that?
I still have
Um,
CDs.
and it was songs, I think it was songs inspired by Joni Mitchell, or it was other people's covers of Joni Mitchell songs. But she had written, there was an interview with her. Either she wrote it or it was the interview of, her thoughts and comments about it. And she said she had stopped listening to music. It was all horrible. She didn't want to hear it. When she drove her car, around town, she rolled up the windows because she didn't want to hear music because it just was heartbreaking to her.
Oh, wow.
And I thought, what happened to her?
Mm.
Well, what's the trajectory here? And I mean, this was the thought I had at the time when I read that. Not suggesting that, that's who she is today, but that's what I was responding to. And I thought, this isn't good. I wonder if she were my patient. I wonder if I could help.
I love that. That's a great answer. It is. It's just interesting, It's like I was trying to think of a fun question. And I think it's interesting too because
I might have come up with a completely different answer if you had told me like you were going to ask me in advance. I would have thought about it.
No, I think it's better. I think it's better to get that gut instinct because you get an answer like yours, which is there was a moment where you wondered that, and it must be strange to go through the world as a psychotherapist and wonder what happened to everyone.
Yeah, how did somebody who was just, so full of, vitality and sparkle, how did she get from there to, what I read in that, that CD insert?
I ask everybody these two questions at the end of the podcast, so it's not just because you're a therapist. What's your biggest defect of character?
Me? Oh, God, I wouldn't even know where to start. I've got so many.
It can be however you interpret that question, whatever comes to mind. It can be one you're working on right now, however you want to respond to that.
I'm hard to really get to know. This is kind of the opposite of what I'm working on with my patients. I can get, self-absorbed and self-centered, which is also the opposite of what I'm working on.
Don't you kind of have to have some kind of wall up, though? If I feel like it's like a strange thing about therapists where you want to get to know them, but you don't really want them to get to know you, do you?
Oh, it's not about want to. I mean, there's reasons why we
Right,
structure the
ethically.
therapy relationship. It's not just about ethics. We structure the relationship in a way that makes it most possible for the person that we're with to reveal themselves. And if we understand that that's what we're trying to do, a lot of things follow about how we have to structure the work to make that possible. So it's not just about ethics. And it's not just about the therapist's personality, although I'm sure that enters into it too. Right? It's about if we keep our eye on the ball of what is the goal here for this person to the extent possible to sort of fully reveal themselves to us and to themselves. A lot of the sort of fundamental principles of how we do therapy follow from that.
Mm-hmm. I have one question that kind of relates to that before I get to my final question.
But if you ask other people, they're probably right. I'm not going to argue that. I mean, I can come across as pretty insufferable some of the time, and people respond to that, and they're responding to something that's there. They're not just making it up.
What's the in that line, what's the best piece of advice you can give a therapist starting out today, since it's such the Wild West? I know my husband takes a lot of wisdom from your Twitter feed in particular. So you are doing a service whether you realize it or not.
I wonder I'm trying. I sometimes
No,
wonder.
you definitely are. I mean, he really is he's very ethical, and he's one of those people that's, he always talks about like the therapeutic framework and having those boundaries. And I think having that, he came into it that way, but having it reinforced by somebody like yourself constantly. And I just know he really takes a lot. So don't feel like your tweets are in vain. They're helping at least one therapist out there be hopefully a better therapist.
Thank you for that. I answer your question. My advice for a newer therapist is get your own personal psychotherapy with somebody who really knows what they're doing, who can really help you to know yourself more fully. Get your own therapy, and a lot of it, years of it, and get a consultant. So in therapy, we use, you probably know the word, but your listeners might not. I mean, learning to do therapy is largely a kind of a mentorship or like an apprentice model.
Mm-hmm.
You have a consultant, or it's called a supervisor, but it's not like a supervisor in your workplace. That's just the word we use. But somebody that you go, a senior colleague, and you discuss your cases with every week, consistently, religiously. This is what's going on with, this patient. This is what I'm struggling with. This is what it's stirring up with me. You got another mind on the case.
Mm-hmm.
And those are two of the pillars of, what it takes to develop as a therapist. Right? Clinical supervision, we call it, or consultation, and personal psychotherapy.
Okay. That's good advice. And what is your biggest asset?
I'm a really good skier.
That feels like dodging the question.
Oh, you're good. You're good. As a therapist, in life, what?
In life, again, however you interpret it.
I don't take things at face value, and I don't take the easy answers. I always ask, as usual, our strengths and limitations are cut from the same fabric. So, when I hear something presented as this is so, or this is a finding, or this is a research finding, I was like, well, how do we know that? What's the assumption? What are the assumptions made along the way to get to that conclusion?
You and my husband have the same brain.
Are the assumptions, do the assumptions really hold up when you look at them? And that's my entire orientation. There's this huge literature on psychotherapy outcome research. I don't think the researchers are always, interviewed by the media and, making these pronouncements about therapy based on the research. And most of it is based on assumptions that I think are false. So it kind of puts me out of, it's a strength, but it also often puts me out of step with other people.
I don't know. I think it's a strength, especially now. I feel very grateful to have a second, in the buddy system of life. My husband is oriented very much that way, and he will say, well, what questions were they asking? And because I'll say, well, there's a study. He's like, okay, I'm going to need to see that study, Bridget. Who funded it? What was he operating?
Exactly so. Like something came up, just, a concrete example on Twitter just in the last few days. Someone's going around saying, research shows that, the therapist's training and experience has, nothing to do with benefit to patients. Therapist experience. I'm like, well, that doesn't really make sense. It's certainly not my experience. I think I'm, infinitely better now than I was a decade ago, and I was way better a decade ago than I was before. And I think you see the difference in my patients and their outcomes. Anyway, you dig into the study, like one study in particular that was making the rounds and getting cited and forwarding around. And it's like, it was done at a college counseling center. There were no experienced therapists in the study. To say we didn't find a relationship between therapist experience and outcome, well, that would require that you have therapists with a meaningful range of experience. They didn't have that.
Mm-hmm.
Second of all, most of the therapies didn't continue long enough for therapy to even begin.
Mm-hmm.
Right? I mean, these are people who would come for most of them, for a few encounters. They were having some, difficult immediate situation. It wasn't a clinical population. It wasn't people who were coming with, serious therapy problems. It was people coming to a college counseling center to, get a little, counseling and move on. So we didn't have real patients. We didn't have any experienced therapists. And then we said, well, what's the outcome? How are we measuring outcome? Like, who decided that these rating scales, capture the kinds of psychological changes that we're actually after in real psychotherapy? I'll look at the rating scales, like, nope, like that's a tiny little sliver of what I might hope is the outcome for some patients some of the time. So anyway, you look underneath the headlines, and often the fine print doesn't fit the headlines.
I also appreciate when you call out kind of anecdotal things that you'll see where they'll be saying that it's therapy and you're like, but this isn't therapy. I just don't think people understand that differentiation is so important, and nobody's really doing this, saying, well, of course you had a bad experience because this isn't therapy. And so we're in a certain way right now in the therapeutic world where it's everywhere and nothing at the same time.
Yeah.
And
if therapy means everything, then it means nothing.
Mm-hmm. And like the TikTok
what was
therapists.
the book that we were talking about at the beginning? The new book about
bad therapy. My friend Abigail, yeah. She makes some good points.
So I didn't read the book, but I read a chapter that was in, published somewhere else. And she described, what stood out for me is everything that she said was, right and was agreed with, and all of the problems and the things that were causing difficulties for her were somebody else's fault, and they would sit around and freely diagnose the people in her life. And it's like, if you think that's psychotherapy, then you've come to the only reasonable conclusion. Well, this isn't helpful. So this is a self-indulgent waste of time if you think it's therapy.
Right.
But that's not what skilled therapists do. It's just not therapy.
And that's what's so hard, is that people will be feeling, it's like, how do you find first of all, most people don't even get a return call from a therapist. Therapists are completely overbooked. They don't even have time to return a call if you're looking for one. And how do you even separate the good therapist from the bad therapist? And usually by the time someone even gets to the point of needing a therapist, they're in crisis. So how do we help? How do we save, or not even save? How do we protect people from bad therapy?
Yeah, that's a big question. For one thing, though, I tweeted about this, but it's not my idea. You can plug into an inflation calculator. I think it was going rates that health insurance companies or managed care companies reimbursed for psychotherapy. I think it was like in 1980 compared to now. It's like, in real dollars, psychologists are getting paid, give or take, 75% less.
Wow.
Than they were paid, in 1980. That's not true for any other specialty in healthcare. Every other medical or healthcare specialty has either kept pace with or exceeded inflation. Right? The role of psychotherapy in the healthcare system has been in free fall for decades. How do you think that affects things? How do you think that affects who you attract to the field. How do you think that affects who even stays in the field, right? This is not the field I ever entered. I mean, just, I'm not that old.
Yeah.
The changes I've seen in my lifetime are just mind-boggling. Like what goes on today in the name of therapy is, would have been unrecognizable when I was being trained. The things we accept and tolerate as, that's the way it is, it's good enough, would have been unthinkable not that long ago.
My husband said too, the general vibe in his master's, just in the school in general around the profession was that it was going to grind you down and you'd end up being in social work or working for the government and you wouldn't make any money. There was just kind of this overall tone of this profession being something that would just it was like a meat grinder that it would eventually do you in, and that sounds horrible too.
Well, it doesn't. I can say it doesn't have to be that way. An awful lot of people are never exposed to, what it really can be.
Well, yeah. I think a lot of people think too that it's like now it's, Jordan Peterson or something like that is the kind of model for what people think therapy is. So there we are.
On one pole of our divided, perceptions of what therapy is.
Mm-hmm. Yeah. And he's helped a lot of people. I guess I pushed back against him years ago online, and I suffered the immediate wrath of his following.
Oops.
And then I had the men write me because this was at a time when I was still at Playboy, I think even, maybe the tail end of it. And my audience is very male, and they wrote me long. This was my favorite part of working at Playboy too. I would say, "Hey guys, I'm writing a piece about ED. What do you think about it?" And they would write me 1,000, 2,000 word essays. I was like, is anyone asking these people how they're doing or what they're thinking?
Because you have your answer there, don't you?
I mean, and the same thing with Jordan Peterson. It changed the way I not necessarily looked at him, but the way I looked at his function in society, just hearing from men who had been so helped by, 12 Rules for Life in particular, that book. So I was the Twitter, sometimes mouthing off on Twitter can be a teachable moment, if you will. This has been fantastic. I wish I could, have you on once a quarter to talk about things, because I think you are an important and valuable perspective on something that is very helpful and necessary, and increasingly seems like everything else to be either or. It's good or it's bad. And
well, it's been fun to be here and talk to you.
Where can we find you? And if you have a book or anything we can read?
I don't have a book. I do have a website. It's my name.
You should have a book.
I have chapters and books. JonathanShedler.com, my name. There's a writings tab on the website, and a lot of articles and chapters are freely available for download. A lot of them are meant for people in the profession, but some of them are meant for a general audience also, and they're identified that way on the page. And I'm involved in a new enterprise called PsychScan, and it's a comprehensive mental health assessment tool that clinicians, therapists can make available to their clients or their patients, that gives them a just pretty comprehensive snapshot of the person's mental health difficulties that are reasons for coming into treatment. And eventually we're going to have a version for the public. People can go and do a self-assessment and get their own information. And that's psych, PSYCH, scan.com.
Okay. Well, this has been fantastic. I look forward to reading more of your stuff on the Twitter X, and I'm going to try and bully Twix. That's good. I just call it X Twitter, since that's technically what it is. And I'm going to try to bully you into writing a book.
That's a nice kind of bullying.
The Check-In with Bridget and Cousin Maggie can now be found at Phetasy.com. It's been titled Another Round with Bridget Phetasy, and it's now in video.
This has been Walk-Ins Welcome with Bridget Phetasy. I'm Bridget Phetasy, and you're welcome. It's the dumbest line.